Okay, we are going to go through the landmarks of the trachea. So this is the trachea itself. It's comprised of 20 C-shaped cartilaginous rings, C-shaped because they don't meet in the back. Here at the end, before we split into our bronchi, we have the carina, and then we split into our main or primary bronchi. Then that goes into our secondary bronchi, and then here on each of our colors are the tertiary bronchi. The secondary bronchi are also known as our lobar bronchi, and the tertiary bronchi are also known as our segmentary bronchi. Okay, we are going to go through the blood flow of the heart as if we were a red blood cell traveling through. So we are going to enter the heart through either the inferior or superior vena cava. We enter the heart into the right atrium because we're deoxygenated blood. After the right atrium, we're going to go through the tricuspid valve into the right ventricle. From the right ventricle, we'll take that deoxygenated blood through the pulmonary semilunar valve into the pulmonary trunk and then out of the pulmonary arteries to the lungs. That's where our gas exchange will happen, and then we'll bring that oxygenated blood back in through the pulmonary veins into the left atrium. From the left atrium, we go through the bicuspid or mitral valve into the left ventricle. From the left ventricle, we'll go through the aortic semilunar valve into the aortic ascending aorta into the aortic arch, and then from there our coronary arteries will get first dibs on the blood, and then the systemic blood transfer will happen from there. Okay, we are going to go through the structures and landmarks of the heart. So starting off with some general landmarks, we have the base of the heart at the top, and then we have the apex of the heart at the bottom, which is opposite of our lungs. And then we have some sulcuses. This is our interventricular sulcus. This is our coronary sulcus that'll wrap all the way around. And then we have our arterial and vein supply here. So starting from our left coronary artery, it's going to split here into our left anterior descending artery, also known as our widowmaker, because it's going to supply blood to the ventricle, our left ventricle. And then we have our left circumflex artery here. Over on this side, we have our right coronary artery that's going to come onto the side here, our marginal artery, and then on the back side, we have our posterior descending artery. For our veins, this is going to be our coronary sinus, which is then going to empty into the right atrium through an opening there. We have our middle cardiac vein here. We have our lesser or small cardiac vein here, and then we have our greater cardiac vein in the front. Going into the heart, we're gonna open her up. Here inside the heart, we have our right atrium. Our right atrium is going to have our pectinate muscle on the inside. This is also where we'll have our SA node into our AV node. And then here on the inside of our right atrium, we have what was once our foramen ovale, and then now, once you're not a baby in utero anymore, it is our fossa ovale right here. And then there's that opening for our coronary sinus that we talked about. So once blood enters the right atrium, it's going to go through our tricuspid valve here. The ends of our tricuspid valve, of both of our valves, are going to be our chordae tendineae, which are going to control the opening and closing. The chordae tendineae interact with our papillary muscle down here, which is going to control the opening and closing of those valves. And then on the inside of our ventricle walls, we have our trabeculae carneae. Trabeculae carneae muscle is going to be on the walls of our ventricles. And then once blood enters through that tricuspid valve, we're into the right ventricle here. In between our ventricles, we have our interventricular septum. And then over on the left side, we have our left atrium, our bicuspid or mitral valve, again, those chordae tendineae, and then down into the left ventricle, we again have those papillary muscle, and then that trabecular carneae muscle on the walls. Going into where blood goes from there, so out of the right ventricle, it's going to enter through our pulmonary semilunar valve into the pulmonary trunk, and then out of our pulmonary arteries away to the lungs. And then blood's going to come back in through our pulmonary veins, enter into that left atrium, through the bicuspid, into the left ventricle. And then we go through here. We're going to enter through that aortic semilunar valve into the ascending aorta, and then eventually into that aortic arch. We do have some branches coming off of here. We have our our brachiocephalic, we have our left common carotid artery and our left subclavian, and then that brachiocephalic will break into our right common carotid and our right subclavian to supply blood to the body. Here we have our superior and inferior vena cava, which is how blood is going to enter into that right atrium. And then from connecting that pulmonary trunk to our aortic arch, we have our ligamentum arteriosus connecting there. And I believe that that's it.